we reached our 4th annual International Sports Pharmacists Symposium. And for last two presentations, Dr. Marc Dzradosi from Ghana. He is the clinical pharmacy specialist and also head of pharmaceutical services, International Maritime Hospital. He will also share his presentation as drugs and sports, the role of the sports pharmacist. Welcome, Dr. Marc Dzradosi. It's nice to see you.
Thank you very much, and it's an honor to be a part of this symposium. It's my first one. I chanced on this, the International Sports Pharmacy Network sometime this year, and I got really excited because I didn't know anything like this existed. And so I'm happy to be a part of this. I hope to be a good resource to support other pharmacists that are also willing to be a part of I call it more of a cohort or a family. So globally, there are quite few pharmacists, but today my topic is just, it's a short one. I have 10 minutes, so I will go over everything very quickly. So we move into the next session. So once again, my name is Marc Dzradosi. I hold a PharmD. I have 2 fellowships, postgraduate fellowships. I have residency. I did residency in cardiovascular care and cardiovascular critical care medicine. And I will just share a brief of my profile. So I'm a former athlete. So I'm a former long jumper, triple jumper, world class. I never made it to the Olympics. I did make the Olympic standard before in 2004. So like I said, non-traditional residency. So I'm a cardiovascular and critical care pharmacy specialist. So as part of what I do, I will share why I got into sports nutrition. I've done WADA training, sports and exercise science. I've done some certificate studies in that. Sports psychology, 2 fellowships, African Games Medical Commission member. So I was the secretary for the All African Games Medical Commission. I was the chief pharmacist for the games, responsible for writing the games manual and basically doing everything pharmacy for the games. I worked with 29 other pharmacists for the African Games, taking care of almost 10,000 people for 1 month. National Anti-Doping Program set up in Ghana. I was part of it. I will share how I got into that. And then Olympic Committee, the Ghana Olympic Committee, I'm part of the medical subcommittee. I was the medical commissioner for the Ghana Track and Field Association, which is the national team. I have moved on to be the vice chairperson for Ghana Masters Program. I'm a clinical pharmacy specialist. So I also developed guidelines for Ghana. So I co-authored the national treatment guidelines, standard treatment guidelines for the country Ghana, of everything from COVID to the sports to also the non-communicable diseases. I teach at 2 universities, and I'm also a visiting lecturer to one of the universities in the United States. I have a residency program in sports pharmacy at the hospital where I work. And I have been on multiple team assignments. So to the Commonwealth Games, to African Games, to the Olympics, and several others. So I have been with athletes for more than 10 years. I have been an athlete myself since I was 17. I ran for the junior national team and competed for the senior national team as well. And so how did I get into sports pharmacy? So I graduated from pharmacy school in 2004. That's a long time ago. But during my days as an athlete, I used to see people use medications, and I wasn't sure why. But as I got into it, especially in the college level, I realized that use of supplements was very rampant and quite uncontrolled. And that kind of raised a little concern. And then I worked in the US for 14 years after graduation. So I lived in the US, let me say, for quite a while. Then I relocated to Ghana and I was invited to be a part of the National Sports Administration. First as not even medical, but I was asked to be the treasurer for the national team. But as we traveled and as we did our local championships and everything, I noticed there was a gap because there was no medical person in the federation. And the athletes needed help with their medications, needed help with injuries, needed help with all kinds of things, nutrition. And so I took it upon myself to start educating myself and helping them. And that is how I got into sports pharmacy. Eventually, we brought in a physician, we brought in a physio and some nurses. And so my role became very unique. I was responsible for getting all the medicines for them, doing counseling and guiding the athletes with anti-doping, providing them with the WADA list every year. And then it was quite interesting. Then I was invited to be a part of the national anti-doping program set up in Ghana. That was also very new to me. So I had to quickly attach myself to the global anti-doping icon who poured a little bit into me so I can do a good job doing this thing. And then I was also part of the Ghana Olympic Committee medical team, traveling with the contingents or the different medical teams to global championships and local championships. I had advisory roles at the sports ministry, which is the Ministry of Youth and Sports, and also to other areas. And then through all of this, I built capacity. But the main thing that for me is fulfilling is the fact that we were able to incorporate sports pharmacy into residency programs, number one, and then also sports pharmacy into our postgraduate colleges. So the Ghana College of Pharmacy and the West Africa Postgraduate College of Pharmacy, which takes care of people from 16 different countries. So sports pharmacy has been defined, so I will not reinvent the wheel because of time. So I will skip this slide and the next slide, which is who's a sports pharmacist. This also has been well defined. But then the question is, I know there are quite a few people on here who haven't gone far into sports pharmacy and they're asking, what does it take for me to be a sports pharmacist? So I'll go over these things quite quickly. Number one, you need a degree and you need to be licensed as a pharmacist. So that is number one. You can't be a sports pharmacist without the degree and without a pharmacist license in your country of jurisdiction or wherever you're going to practice. You will have to take a few courses in pharmacy or in sports pharmacy. And it really helps when you are managing athletes or people within the sports fraternity. And I have to say that I think there's a slide that talks about who our audience are. And I think that has already been mentioned quite a bit. At the bottom, patient population, we have to say that even though sports pharmacy has to do with sportsmen and athletes, the coaches are also part of the people we take care of. The officials are part of the people we take care of. The volunteers that work at the competition sites and championship areas are part of it. The immediate community, and sometimes the people, spectators, retired and masters athletes. So basically, it's a continuum. And there are also even injuries in children. So as a sports pharmacist, you must have knowledge in managing people across board from pediatrics all the way to geriatrics. And I think that has been mentioned in previous presentations. So the key thing is we are the medicine experts, we are part of the athlete support personnel, we are part of the medical team, and we are the drug experts. And sometimes we end up, most of the sports teams typically may not even have a medical officer on board. They usually may have physiotherapists and others. And so your knowledge becomes handy, especially with internal medicine and a little bit of sports injuries and rehabilitation. So as a sports pharmacist, you need to diversify a little bit of what you learn. So courses in sports pharmacy, number one. Anatomy and physiology, you must know anatomy and physiology as a sports pharmacist. And then also some basic knowledge in sports and exercise science. I had to do a little bit of that because I needed to understand what happens to athletes when they perform, what type of injuries they get, and the background behind those injuries. So when the physios or when the doctors are treating, you can relate and make the proper recommendations for treatment. Learn a little bit of injury prevention and management, learn a little bit of drugs and sports, It's very refreshing to hear that a lot of our colleagues have the certificate of drugs in sports. Yes, it's one of the things on my bucket list. So I hope to get to it. I think when they started, I was doing another program in global health. So I didn't get to enroll, but I will get into it. And then get on the WADA website. There are a lot of free courses, related courses from different areas, and then master your trade. You should be well versed in therapeutics and toxicology, uh, medication overdoses. Now it's quite rampant. Therapeutics as in the different types of diseases and how to manage them, because sometimes in our athletes, a lot of things will happen on the field. And then you must understand drug-related sporting disciplines. So sports is different, or management of pharmacy, sports pharmacy is different for different sports. For example, box is different for what we encounter with boxing, different with what we encounter with hockey, different with what we encounter with soccer, track and field, tennis, everything. And so when you really understand the type of things that happen to these athletes, you can better make the best recommendations and also support how they are managed. So it's very, very key. What roles do we as a sports pharmacist? So number one, our responsibilities are based on or are defined by sports governing bodies. So with sports pharmacy, WADA is one of the key governing bodies that we work with. So World Anti-Doping Authority, World Anti-Doping laws, and they restrict and guide our practice. So we don't just go and work anyhow or practice anyhow on the field or within the sports fraternity. And then IOC, International Olympic Committee, medical code is another thing that we work with. And then there are rules and regulations that govern pharmacy laws together with the state law of where you practice. So these are key things. And then we'll also go with the WHO guidelines and all of that. But basically, point two, everything we do must be evidence-based, must be clinical guidelines-based, and these are key things that are very important in the way we do our things. So we are responsible for all the medicine-related needs of our athletes. One of the first things I did when I joined, I became one of the medical personnel for the national team, was to set up a WhatsApp group of all our national athletes. And then I made myself available for all their drug-related needs, from anti-doping to the use of supplements to counseling to education to helping with some of their ailments and all of that within doing what is within my scope. And I make sure I didn't go outside what is within my scope. We developed guidelines and protocols and manuals and policies. I was the chief pharmacist for the African Games, and I was responsible for developing the games manual, getting the drug list, training pharmacists and use of medications in athletes, policies, monitoring, doing research, documentation, procuring of medications, and then being on the field with the specialists. Because I have a critical care background, we had athletes that developed heat stroke and all of that, and I was in the midst of it. So these are key things that makes you really, really valuable as a sports pharmacist. And then we guide, we consult, we educate, we advise. These are normal things of daily things that we do on the field. We serve on committees and perform other roles as assigned. So I do serve on quite a lot of committees nationwide and also globally. These are things that have been due to some of the knowledge that I've gained over the period. And then drug information specialist documentation. I help with competition operations planning and then research and innovation. So we do collect a lot of data and then we write on it, we publish some of it. So these are very, very key things that some of the young and upcoming pharmacists can pick up on. Some other specialties, so therapeutics and drug safety, medical management, you should know how to manage our patients. Everything from their ailments to even blood pressure control, diabetes, all of that, very, very necessary. Anti-doping, there are different phases of anti-doping, from testing to the therapeutic use exempt. So for example, African Games, I was part of the therapeutic use exempt committee, and it was quite refreshing using my pharmacology knowledge, pharmacokinetics, pharmacogenomics, and all kinds of things to help make decisions that govern athletes' use of medications that are on the banned drugs list or prohibited drugs list. guidance and counseling, we do a lot of that. Education and training, not only for the athletes, but also their handlers, their coaches, physicians, prescribers, everybody. Toxicology, whenever there is any type of overdose or adverse drug effect, knowing how to assist in managing these things are important. Athlete support, from everything from supplements to performance-enhancing drugs, sports nutrition, sports psychology, mental health, very, very key area. Pharmacists can really do some courses in this area and support, because most of our patients per se are involved in some of these medications or supplements that affects their mental well-being. And then medicine supply chain, procurement of medicines, making sure the right drugs are available, and all of that, monitoring and evaluation. And then we mentioned special populations, as in female sport pharmacists, geriatric pharmacists, pediatric sports pharmacists, and other various disciplines. Very, very important things. A few other areas that I think the last but one slide, pardon me for the time. We have key drug information experts, and then most of this drug information is modified for their athletes and their entourage. Don't forget, one size does not fit all. So in terms of managing athletes, our drug information has to be modified for them. And then drug-related needs for other support personnel, anti-doping codes, local and national, international drug law, clinical investigations. We do a lot of clinical investigations where in my jurisdiction. And then documentation of medical records, very, very key. What you do not document, you haven't done. So it's very, very important to document your work. And then the new thing, physiopharmacy, pharmacogenomics, translational medicine, that is the new it for pharmacy, sports pharmacy as well. So we should also make sure we are well versed in that. And then we've mentioned pharmacy operations, meet management, or competition management. We are usually part of that. Which organizations can you work with, or what can you do with your pharmacy, sports pharmacy specialty? One, medical facilities, rehab centers, sports teams or clubs, local communities, sports, national sports organizations or national teams, anti-doping, local, national, or global, local and international sporting events, athlete support groups, National Olympic committees, IOC, FIFA, World Athletics, FIP, etc., etc. And then you can also be an educator. So universities and advanced learning, those are another place to be part of it. So in conclusion, we are integral members of athlete support and then medical support teams. Medication use in sports for various reasons has reached alarming rates, both legal and illegal. And our knowledge and expertise and guidance is very well needed to help save the situation. Most athletes and coaches are not aware of the dangers of drug use, and that is where we come in. And then most medical personnel and prescribers are not aware that drugs can be used, or of what drugs that can be used safely in athletes. So for example, at the African Games, some of our prescribers really prescribe medicines that an athlete could take and get them in trouble. And pharmacy have to step in and go to them and say, hey, by the way, this person is actively competing, you cannot prescribe this medication. And they say, oh, we didn't know. So these are some areas that pharmacists can intervene and then protect our athletes. So finally, our expertise is needed. Let's build capacity. Let's learn. Let's get into programs that can help us improve our knowledge. And let's go out there and make a difference. So once again, my name is Marc Dzradosi. This is my contact information. And I'll share my slides after when needed. And then these are my references. Thank you.
Yes, thank you. Thank you. Really appreciate for your contribution, Dr. Dzradosi. So you highlighted all the important responsibilities for the pharmacists in the sports field. And as your final words, our expertise is needed. We all agreed about this. And after maybe more than, nearly 20 years, we are studying and we are trying to improve this area. But at the last years, this sports field, other experts or athletes, trainers, and parents also, they all agreed that they need pharmacists in this area. So because of this, we all try to develop our expertise in the academical base, and we all try to provide our services, as you mentioned, in the evidence-based approaches. So finally, we agree that okay, the problems could be common, but also the solutions are common, and we have the shared mission. Thank you again for your valuable contributions.
You're welcome, sir. Thank you.
And let me please check the chat zone. And there are also they are sending their good wishes.